So I'm going to prep for a trach suction. So first thing I'm going to do is I'm going to assess my patient and make sure he needs this done. So he is coughing a little bit. I'm going to listen to some lung sounds. I hear some crackles, and I actually see a little bit of visible phlegm. So we're going to go ahead and continue with the suction. First thing I'm going to do, I'm going to place some oxygen over his trach to get him well oxygenated since he's on room air right now. I'm going to set that at about 2 liters. And then I'm going to sit him up into the high Fowler's position. Next, I'm going to perform some hand hygiene, and then I'm going to check my suction source. I'm going to make sure everything's working properly and make sure it's not going to exceed 120. So we should be in that green zone. Everything is going to look good there. So next thing I'm going to do is I'm going to grab my sterile water and I'm going to loosen the top a little bit. So set that aside, and I'm going to open my kit. First thing I'm going to do is grab my sterile gloves. I would want my table a little higher than this naturally, but working with what we got here. So I've got my gloves on. Next thing I'm going to do is I'm going to reach in and grab my little basin and set that in my sterile field. Next thing, reach in, grab my tubing. I'm going to take that out. Throw that away. In my dominant hand, I'm going to wrap this so this part is out. All right. And then next, we're going to first disconnect him from his oxygen with this hand. We're going to lip some out of this water bottle, which I'm not going to do at home. And then we're going to pour a little bit of sterile water into our basin. Then we're going to connect our 2 tubes. So I'm connected to the suction, and I can unwrap this. I'm gonna dip the tip into the water and make sure that suction is working. It is. So next we're going to start suctioning. So I'm going to start inserting this while maintaining sterility until the patient coughs and or I meet resistance. So I've met resistance, so in a circular motion while suctioning intermittently, I'm going to remove this tube. All right, dip my water in my basin, and we're gonna do that one more time. So we've met resistance, so we're going to withdraw. Awesome. So we're good. So I'm going to disconnect, throw this away, and then I'm going to reconnect the suction out his mouth, and check lung sounds again, and make sure everything sounds good. And that is the end of this.